We will now demonstrate on an adult how to assess extraocular movements. The patient should be seated and you should position yourself in front of them. The room should be well lit and free from distraction. Firstly, look for any obvious abnormality of eye position, the eyelids or pupils. The picture shows a third nerve palsy with dilated pupil and deviated eye. Look too for any evidence that other cranial nerves may be involved, such as facial asymmetry. An abnormal head posture may indicate a problem with the extraocular muscles. For example, if a patient has a weak left lateral rectus muscle, which pulls the eye to the left, their head will turn to the left to overcome this weakness. Eye movement should be tested without glasses, so if the patient is wearing glasses, ask them to remove them. First, ask the patient to look at a pen torch held in the primary position, which is straight ahead at eye level, at 50 centimetres. Look at the corneal light reflex. If the eyes are aligned, they should appear to be in the same place in both eyes, as shown here. In this picture, the reflex does not appear in the same place in both eyes. The eyes are not aligned. There are 6 muscles attached to each eye that control eye movements. Different extraocular muscles move the eye in different directions. The muscles controlling each eye are linked or yoked together. If the eyes move to the right, the lateral rectus in the right eye must be activated, and the medial rectus in the left eye must also be activated. The diagram shows the muscles that are involved in producing 8 of the 9 positions of gaze. The 9th position is straight ahead. You can pause the video to look at this diagram in more detail. The initials refer to the 4 rectus muscles and the inferior and superior oblique muscles. We will now test the individual eye muscles. The 2 eyes are first tested together. Hold a pen torch at 50 centimetres in the primary position. Look again at the positions of the corneal light reflex on each eye. Always start each eye movement from the primary position. This will allow you to see the full range of movement. Keeping the pen torch at 50 centimetres, ask the patient to follow it with their eyes, keeping their head still. First, move the torch to the right. This tests the movement of the right lateral rectus and the left medial rectus muscles. Return to the primary position and ask the patient to follow the torch to the left. This tests the left lateral rectus and the right medial rectus muscles. The next position to test is up and to the right, which tests the right superior rectus and left inferior oblique muscles. Next is down and to the right, testing the right inferior rectus and left superior oblique muscles. Now repeat on the left side. Up and to the left, testing the left superior rectus and right inferior oblique. Then down and to the left, testing the left inferior rectus and the right superior oblique. Throughout testing, you are looking for reduced or restricted movement of any of the muscles. This video shows restricted movement of the right lateral rectus. You're also looking for any excessive movements of any of the muscles. This video shows excessive movement of the left inferior oblique and reduced movement of the left superior rectus. Ask the patient if they're aware of diplopia in any position of gaze. Note also any changes in lid position during testing and the presence of any nystagmus. Testing eye movements can be difficult. Careful technique combined with the use of a cover test demonstrated in another video will enable you to detect an abnormality in eye position and in some cases to pinpoint an abnormality in the extraocular muscle causing the problem. Never forget that children with a squint require a full ophthalmic examination. It is particularly important to ensure they do not have a cataract and to look at the retina to exclude the possibility of retinoblastoma. The onset of double vision in an adult may require help from a neurologist to determine the cause.